On his first full day in office, President Trump signed an executive order reinstating the Mexico City policy, also known as the global Gag Rule. The administration says it's about stopping abortion funding, but it's not. Here's what you need to know. Fact. The US hasn't funded abortions abroad since 1973 because of a law called the Helms Amendment. The global Gag Rule goes much further. It prevents the federal government from funding organizations that provide access to or information about abortions. It doesn't matter if the money won't actually be spent on abortion services. Republican presidents since Ronald Reagan have imposed their own versions of the Gag Rule, but President Trump's is the most extreme. Instead of only targeting family planning groups, the ban applies to any organization, regardless of what services they provide. In other words, if a facility that provides cervical cancer screenings even mentions abortion, it may be forced to scale back or shut down for lack of US funding. And when facilities in poor regions close their doors, women often have nowhere to turn for contraceptives, cervical cancer screenings, HIV or AIDS treatment, and other essential services. The results could be devastating. Close to 300,000 girls and women already die each year due to pregnancy and childbirth-related causes. That's more than 800 a day. By some estimates, the global Gag Rule under President Trump will cost the lives of 21,700 young mothers in the next 4 years alone. The future doesn't have to be so grim. If the unmet need for contraceptives were addressed, maternal deaths would drop by 67%, newborn deaths would drop by 77%, and the lives of nearly 2.5 million mothers and babies would be saved. And that's just the start. When women take control of their health and family planning, they can get a better education, find a job, and lift their children out of poverty in a single generation. Consider this. Doubling current investments in family planning would save the global economy $15 billion due to improved productivity. Right now, Global Citizen is calling on countries like Belgium, Finland, Canada, and Denmark to step up and meet the need for women's health. You can help. Take action today and tell your leaders that women's health is something she decides.